in the US, we have pharmaceutical companies that influence some physicians prescribing their medications. And I think that is a conflict of interest. And if a physician is going to prescribe a patient some medication to someone, they need to be honest and tell them, like, I am involved in this trial. Or obviously that's it's something that I've read about, but talking to physicians such as yourself, I've rarely seen that in my personal experience. I mean, does it happen quite often, or is it quite rare that some physicians actually?
Yeah. So, we have stories, that throughout medical history where, for example, people may recommend more surgeries than usual because they own a stake in the surgery center. So now they get paid twice, as the surgeon as well as the owner of the surgery center, or someone who owns or is part of a pharmaceutical company. Look at Dr. Oz. He sells all of these supplements and gets paid by those pharmaceutical companies. So he has a stake in whether the company does well or not. And so, it's a reason to push something that may not be evidence-based. And same with Dr. Phil. Whereas, I think most people in, academic medicine, usually when I get a lecture, they'll say, these are my conflicts of interest. These are the 4 companies I work for. Every once in a while, I'm a consultant for a birth control company. Now, I do get paid a small amount. I think it was $300 to give my opinion as an OBGYN, but I don't push their medicines anymore than I would other medicines. And when I do talk about their medicines, I make sure that my patients know, hey, by the way, I'm a paid consultant for this company, but I want you to know these are the benefits and the risks of that medication, and be aware that I'm a consultant for that company on rare occasion. And it wasn't even for the medicine that I was talking about. It was because they wanted to look for new medicines and wanted my opinion on what I thought patients would be interested in. But again, you have to be forthcoming about that. I think a lot of the people who really make a lot of money on these things, like, Dr. Phil and Dr. Oz, they aren't that forthcoming about that. And that's that snake oil salesman kind of tactic, where they're selling you things that maybe aren't so evidence-based because there is a financial goal at the end of the day. And so we don't just see that in the holistic world. We see that in the standardized medical world too. And so it's really important to know, you can look that stuff up on the internet, how much money did your physician get paid and what companies paid them. But, they should also be straightforward with that, and you should be willing to ask that, and they should have an open conversation with you about that.
Obviously, it's quite controversial with Dr. Oz. I didn't know so much about Dr. Phil. I thought he was a non-MD doctor. I thought he was a psychologist.
He is, but he still, basically puts his name behind products that aren't necessarily proven because he has a financial incentive.
Wow, so that's quite interesting. I'm guessing he's probably got a PhD or some other doctorate in psychology, but yet portrays himself as a medical doctor with products and other products that he sells and pushes. That's quite.
Same
strange.
with Dr. Oz. He went to some of the best schools in the country and really is a church and have been found to not be successful. But still, he gets financial incentive for pushing those products. And, if you watch some of his ads, it'll even say, that it's sponsored, or I'll hear things with Dr. Phil where he says, he integrates it almost as if he's having a conversation, but it ends up being a commercial for something that he's trying to sell. And of course is incentivized to sell those things because of the financial implications.
Yeah. And we're seeing a lot of that now with a lot of medical influencers coming online. There's a whole host of people coming on. And I've seen some people who actually sell supplements. And it is kind of controversial too. But then I've also seen some people who don't go into that, medical influencers who don't sell anything because they don't want to, because they know it's like a conflict of interest within the medical profession.
Yeah, one of the first people that reached out to me once I started becoming popular on TikTok was like a Norwegian or Swedish vitamin company. Would I be interested in getting paid to promote their product? I had never even heard of their product. I didn't know any of the research of their product. But of course, had I not had medical standards, I could certainly accept a cash allowance in order to promote this product that I really didn't know anything about or believe in. And so I make it very straightforward. When somebody gives me something for free or pays me to promote something, I'm going to say that they gave me this for free or that they paid me to promote this. And I will never promote a medical product that I don't believe in and that I don't believe there is evidence for. And that's one of the issues that I think the medical community has with people like Dr. Oz, is that essentially he has sold out his medical education to the highest bidder. And, this having nothing to do with his politics, but that, does make you worry. What is he willing to say? Is he willing to say anything at a cost?
Yeah, I knew of another medical influencer who actually made a video about pre and probiotic supplements, how ineffective they are, that they may be beneficial for two things. One was diarrhea, and I think one was IBS. But a company then approached him and they were paying him a lot of money, 3 times his salary as a retainer of what he earns a month. But he declined them. It was tempting, but he actually said, I can't. I made a video saying that you don't need them. Now I've got opportunity to sell them. Like, I can't do that. So it's interesting that it's tempting when you have a lot of money, like a big jump of change from a company that are actually trying to approach you to sell the product. But at the same time, you've got to be kind of honest to yourself, because it is actually controversial. And I mean, it'd be great if the product was great, a good product which had a lot of evidence, and then you could go behind it and say, okay, from an honest point of view.
Yeah, absolutely. Again, a lot of, new doctors, we're in tons of debt. We're working hundreds of hours a week. We barely see our families. Sometimes my son tries to feed the phone when I'm FaceTiming him at night from the hospital call room. And so, you are incentivized, or, there is that appeal of taking that big paycheck and having a good quality of life. And a lot of people do end up doing that. And I understand it. It is appealing to essentially win the lotto and have a better quality of life. And all you have to do is sell out your morals. But with that being said, a lot of us find that that's not appropriate. And, if you are going to do that, you should be straightforward that you're doing that.